educators. Dr. Wall and I are thrilled to offer an extra bonus webinar this year that is recorded. This is one you didn't have to join. It's one that we thought we would go ahead, record, and make available to everybody so that there wasn't a conflict of your schedules, our schedules, when it was going to be recorded, that all of this information we were going to share is available to you on demand when you're ready for it. So Dr. Wall and I are going to focus today on candidate performance for class of 2024, just the complete review now that we are so close to the end of the year, and then how we are with the class of 2025 currently looking forward into finishing, heading into graduation in May and June. So this is information we would typically provide at an educators conference that was in January. We know that you all find it extremely helpful. We did this information in October. Dr. Wall presented on it. And so from here, we're going to give you a little bit more complete picture of how the class of 2024 is finishing. And then again, what 2025 looks like. Dr. Wall, thanks for joining me with this today.
Oh, it's my pleasure. This is something that I look forward to and really hope that this is very helpful for you educators, and anything we can do to help provide you with information that is helpful as you work with your students in preparation for the exam, and also just to help you reflect on how things went, and just to see how things are going nationwide as well. So these numbers are from candidates all over the country. So hopefully this is helpful and gives you an idea of where things are at. So we'll go ahead and jump in and start with the diagnostic skills exam and give you some information. Again, not a lot has changed since we presented this in September, but now more complete with the end of year. And you see here the number of candidates and the initial attempt passing percentage. And students generally have done very good on this exam. They've done very well, consistent year to year, very well prepared for that examination. Moving on to the endodontics clinical examination. You see here a number of candidates that took this exam from the class of 2024 and the initial attempt passing percentage. This is the class of 2024, so everyone from the class of 2024 that took it throughout their time as a dental student, this is reflected here. And this is a little bit of an improvement from the class of 2023, which was 84%, so a little bit of a step up there from the class of 2024. The most common errors contributing to failure. This has been pretty consistent year to year. So we're seeing a lot of consistency here. The number one error for the anterior tooth is overfill primarily. Overfill and underfill are lumped together, but the primary error that we see in general is overfill, meaning the gutta percha is out the apex more than 0.5 millimeter. And then the size, generally a posterior, the number one error is too small. So what that's saying there is that it's either in a buccal mesial or mesial distal or buccal lingual dimension less than 2.5 millimeters. So that's the primary error. And even for the anterior size, pulp horn removal, meaning it's too small to remove the pulp horn. So we do see that as a consistent error year to year, is that a large portion of these are being prepared too small. The access opening is. When you have the size from the incisal extent for the anterior, that just means it's too large and encroaching on that incisal edge, compromising the integrity of that incisal edge. And then the mesial extent for the posterior is one that we commonly see as well, just getting too close to that mesial marginal ridge. And then perforation is one of those errors that we've seen consistently, one of the more common errors that we see for the posterior tooth as well. Moving on to the prosthodontics exam, you see here again the initial attempt passing percentage, which has remained pretty consistent, and most common errors. Really, what we're seeing a lot of is the under preparation in almost all the crown preparations that you see. The under preparation is the most common error. Occlusal reduction is similar to axial or lingual under preparation for the ceramic crown, the anterior tooth. And just in general, under preparation is what we're seeing is the most common error. The path of insertion line of draw for the cast metal crown, that we evaluate the bridge factor under the cast metal crown. So that factor really does apply to both the PFM and cast metal, but we see that showing up here under the cast metal crown because that's where it's evaluated. One thing that we have been seeing as well in the last couple of years that wasn't consistently one of the most common errors was this external internal line angles being too sharp, meaning they're just not rounding those, or it doesn't really show evidence of any rounding and leaving those edges just too sharp. For the periodontal exam, you see here the initial attempt passing percentage. The most common error, most commonly for the class of 2024, it was calculus removal, meaning there were 4 or more surfaces with calculus that were not removed. They left calculus remaining on 4 or more surfaces. That was the most common error for the class of 2024, followed by tissue management. And those are the 2 areas that are really evaluated for the periodontal exam. Anterior restorative for the class of 2024, you see the initial attempt passing percentage, common errors, again, very consistent and pretty consistent between anterior and posterior. Caries far and away is the #1 error, meaning there was caries remaining in the preparation. They did not treat the caries or remove the caries appropriately. So that's consistent with even back when this was performed on a patient. So those errors, including the most common error for the restoration, is an interproximal contact that is either open or irregular. So those were always the most common errors, and we still see that consistent with the competent tooth as well. Sound marginal tooth structure, what that speaks to is the unsupported enamel. So that was an error that we've seen more and more commonly with the anterior and posterior. That's one of the most common errors, is leaving unsupported enamel, not just little J hooks or a little bit of an upturn to that margin. It really is more significant where they're leaving some of that interproximal wall of enamel and just something that would not function appropriately for the tooth. Adjacent tooth damage is something we saw as well. And then margin excess, margin deficiency, those are pretty common things that we see year to year for the most common errors. Again, posterior, same, very similar factors here, and something consistent year to year. Axial walls, that's an over preparation of the axial walls without a modification request, is #2. Caries always is the #1 error. And then sound marginal tooth structure, again, is the unsupported enamel. Interproximal contact, open or irregular for the restoration, always the most common error for the restoration. Margin excess, and then interproximal contact closed. For that to be applied, that's one of those where there has to be an evaluation of all 3 examiners, and none of them can get floss to pass. If any of them get floss to pass, then that's an objective finding that is corrected by a captain. But so that's where they just overfill things to the point that you just can't get floss between there, which would be a problem for a patient, obviously. So as promised, here's the information. This is something we were not able to present in September. So this is something we do want to make sure we present. Now, this again is as of mid-December. So there could be a slight update, a few candidates that may still be lingering out there that are trying to complete this examination before the end of the year. But most exams at this point have been completed. And so this is a pretty good end of year number you can see here for each procedure, each examination part, the first attempt passing percentage, and then the end of year, how many candidates, what's the percentage of candidates that have been successful and have successfully passed that part of the exam at this point in the year.
And isn't that based on using their 3 attempts per procedure?
Exactly. Yeah. So those that have attempted each part of the exam and taking advantage of everybody gets 3 attempts at each exam part. So that is reflected there. Yeah. Now we'll move on to the class of 2025. So these are preliminary numbers for the class of 2025, those that have completed these parts. So this is primarily the PEP examination, the prosthodontic, endodontic, and periodontal examination parts for the class of 2025. We wanted to give this information. This is something that we were not really able to give a whole lot of information on in September. We've gathered a lot of information now. We've got a lot of data to present. So we did want to take advantage of sharing this with you at this stage and where things are at. And this is, so you do see here for endodontics, this is an area where we have seen from the class of 2025 a change in performance. And those of you, I'm sure everybody's aware, we've moved to the ModuPro OS3, the accidental segmented model for endodontic and prosthodontic procedures. And the biggest difference we're seeing in performance so far has been the overfill of the anterior endodontic tooth. All other parts of this have really remained pretty well consistent. And as you saw for the class of 2024, the number one error was overfill of the anterior tooth. So that is consistent, that is still the number one error we're seeing. We are seeing more of it this year, which is what we see is contributing to the lower percentage of initial attempt passing percentage. So this is one of those that we looked at, we've looked very carefully. We've tested this tooth extensively, and we find the tooth to be consistent with what is said in the manual. That is consistent with a 21-year-old patient's internal anatomy with good apical constriction of that, the orifice at the end of the apex. And really, so one thing that we do know that changed with the OS3 model is that there is a little bit of a gap between the end of the root and the base of the sulcus in that model. So which does lend itself to a greater possibility of a candidate maybe over-instrumenting because there's some more space there. And so that's just something that we're noticing, and just wanted to pass that along to you, just like we would normally with data towards the end of the year. And then, yeah, all the other errors are really consistent with what we've seen in previous years.
Ben, the one thing I know that we don't have data yet, because this is all still happening now, we're in some retakes. But for this anterior endo tooth, of the group that we were unsuccessful in that first attempt for overfill, are you seeing it being corrected in these retake exams?
In general, I would say, yeah. So students, it is being, they recognize the error. One thing that we do for current students is we do send images that really do clearly demonstrate the error. We have some of those images that we'll be happy to share in this webinar as well. But yeah, so we are seeing that in general, it's being corrected on subsequent attempts. And the other thing with the endodontic exam, the one change that we saw for the class of 2025 also was that we're not seeing as many perforations. As you may be aware, in previous years, the perforation has been one of those top 3 errors. And so that's one that maybe was a little bit of a change for the endo, for the posterior, not seeing as many perforations as we've seen maybe in the past. For the prosthodontic exam, you see here, again, the initial attempt passing percentage, very similar to previous years. And we are including here the top 4 common errors contributing to failure. We saw that some of them were the same for the number 3 and number 4 really were the same. So we just wanted to include all that information here just so you could see. And again, under preparation on all 3 crown preparations is still consistently the number 1 error that we're seeing. Not a whole lot of change there. The bridge factor between the 2 posterior teeth. We do see a little, maybe the axial tissue removal being over for the PFM crown. That one moved up a little bit. And then external line angles, those sharp, unrounded, those very sharp external line angles, that now has been the number 2 most common error leading to failure for the ceramic crown. But other than that, very consistent what we're seeing year to year. For the class of 2025, similar results that we've seen in previous years, but for this year, it seems that the number 1 error contributing to failure is the tissue management, meaning major soft tissue damage. More than not, hard tissue damage didn't really make the list here. This is soft tissue damage. And really, for it to be considered major soft tissue damage, this is something that would require some kind of post-operative treatment or follow-up care, whether that's suturing or periodontal dressing. Those are things that would be considered major soft tissue management problems. So now we'll talk a little bit about some updates and some reminders for things moving forward as you're getting ready for exams that are happening starting in January of 2025. To start with, just as a reminders, especially those of you that have not, maybe your school has not taken the prosthodontic, endodontic, and periodontal exam yet. So we'll talk a little bit about that. Ever since August 1st, we have started using the ModuPro OS3. which has been very beneficial for the flow of the exam. If you remember from last year, we had to switch out the mandibular model so that we could have something that would articulate for the prosthodontic exam, and then switch out the periodontal model that didn't really articulate with the upper model. And so that we'd have to interrupt kind of the flow of the exam to switch out those mandibular arches. So that's been a great benefit for candidates during the exam. And just really for overall exam flow, that's been very good. We have, in our working with schools, we do find that most dental programs have changed over to the ModuPro OS 3. And the anatomy, just remember for those teeth, the anatomy is consistent with the restorative exam, what's used for the, with the compodont tooth, and also just any accidental restorative teeth that would be the same tooth for this OS 3 model as it is for your restorative models that you use. So now you can just buy one kind of replacement tooth for candidates to practice with and so forth.
Dr. Wall, can I confirm though that when you say same tooth, what we mean when we say that it isn't the same as the exam tooth?
Correct. Yes. So the restorative anatomy and the prosthodontic endodontic tooth anatomy is the same. That's an excellent point. So yes, so the test tooth is not the same tooth necessarily as what you may purchase and practice on, but the materials are the same. So really the practice teeth are designed and meant to be something that you can utilize to practice on and get a feel for the materials, but not necessarily be the identical internal, workings and anatomy of the tooth, similar to what we have for the compodont exam, that you can buy practice teeth that give you a good feel for the materials, but not identical to what you might encounter in the exam. That's an excellent point. Thank you, Shayna.
Yeah.
Some of the benefits of the ADEX examination is one of the things that we are happy to allow and provide to candidates is this complimentary retake per procedure. For now, that is something that's been something we've been able to offer recently, and we're happy to continue to offer that. The complimentary retake, that's per exam part, one complimentary retake on each exam part. Then as far as the 2025, as we've communicated before, ADEX has approved the movement to as far as 3 different lengths of the anterior endo tooth. And so that is something that will be coming, but not until later in 2025. So as all of our exams since August 1st of 2024 have been the same length for all candidates. So each candidate has been getting a tooth that's the same length, and that will continue in the initial stages of 2025 through the end of the school year for 2025, really through July of 2025, and at which point that's where we plan to introduce the variable lengths of teeth. So as always, we encourage students at every examination, every candidate is required really to measure the length of the tooth for themselves, and they mark on the progress form. With their initials, they indicate that they did measure the length of the anterior tooth. So that's an important step in this examination. We do recommend that they use an instrument that they're familiar with and they know how to use and get an appropriate length measurement, and then they can write that down. But really what's required is that they initial the form indicating that they did measure the length of the tooth.
And Dr. Well, I'll add on that just to clarify is that we had previously communicated that the 3 different lengths would be starting in January. What you've just said is the length is going to remain a single length through July, instead of that change happening in January.
That's correct. Yes.
And then the other thing I'd like for you to hit on really quick is that while the candidates are measuring this length and they are writing it down, and you have done your fair share of double checking, because there was some communication amongst students and faculty that, well, we all had different lengths, when in reality, it may have been a measuring thing and not a different length thing, but that any social media how to pass the exam may not be in their benefit anymore.
Absolutely. That's an excellent point to make because we have heard that, and we've had requests to validate and to verify and make sure, and we've done that every time we've had the request. We've looked at it to verify because we have heard reports from students, from candidates, whether online or otherwise, that oh, they went to variable lengths and everybody had a different length in the exam. That is, I can confirm and verify that it is only one length. The tooth, there's only one length that we are providing as an exam tooth. And so yes, I again measure the tooth, make sure you get an accurate measurement, and then trust that measurement. And but yes, I agree with you. There's a lot of information that may even be old information of tips and tricks and how to pass this exam. And yeah, utilizing those tips and tricks may not be to your, really probably won't be to your benefit, as you just do what you were taught to do in your endodontic training by your endodontic faculty. That's always our recommendation to students. Treat it like you would a patient based on the information that you've been given by your faculty and the training you've been given. And then that's the best advice we can give people for the examination. So moving on to the restorative examination, one thing we did want to talk about, because one thing we saw a lot of in the class of 2024 was we saw a lot of requests to remove unsupported enamel. And we did add a clarifying note in the manual for this, for class of 20, for January 2025, the new manual. We did give some clarifying information. Really, for the most part, the request to remove unsupported enamel is considered an inappropriate request and will almost always be denied. There are very few cases in which a request for unsupported enamel would be appropriate. One example would be they've had a previous request to modify the incisal wall of a class 3 preparation, and the caries have now been removed. There's no caries there, but the incisal wall is thin and fragile, and they would like to now change it to a class 4. And that would be an instance where the only reason they could give, the reason for removal, the why under the modification request would be unsupported enamel. And in that case, it would be an appropriate request. What we saw a lot of in the class of 2024 is they would request to remove unsupported enamel that they themselves created, either by over preparing or by not removing that enamel as they should as part of the original preparation or the original modification request. So for example, if they're modifying the gingival floor due to caries and they've asked to extend the gingival floor 0.5 to 1 millimeters, and they reduce the dentin and leave the 0.5 millimeter of unsupported enamel, and they're asking to remove that, well, that could have been removed as part of their modification request. And so that would be, the examiners cannot approve them to remove more of the gingival floor because they were already approved to remove that, and they're just leaving unsupported enamel. So that request would be denied. The other thing is if they over prepared the gingival floor, if they extended the dentin too far, and removing that unsupported enamel would then overextend that beyond what they were approved, that again can't be approved because they've already committed the error of overextending the gingival floor. So really, in most cases, the request to modify a preparation for unsupported enamel is not considered something that can be approved. So just keep that in mind as you're working with candidates and getting ready for the restorative exam coming up. That's just something that we wanted to clarify and make sure was clear for everybody. As has been the case, we will continue to have the assigned teeth and the adjacent teeth with competent technology that reflects the hardness of real tooth structure, dentin, enamel, with a soft pulp, and the caries is still that competent caries that is really reflective of the natural tooth structure and natural tooth caries disease process. So that's something just wanted to communicate that, and it's working very, very well as far as what we're evaluating there. Again, for restorative exam, just like with the prosthodontic, endodontic, and periodontal exam, the 2 exam parts for the restorative, anterior and posterior, are graded separately. So if a candidate is unsuccessful on either the anterior or the posterior or both, it's a complimentary retake of each of those exam parts for their first unsuccessful attempt.
And I'll just add, while it is a complimentary retake, they do pay for the patient that second time. So there is a $150 typodont fee that goes along with it, but they definitely aren't paying for the full exam or that full part or section again.
Absolutely. Good. Yeah. And that typodont fee is per exam part, just like you said. Excellent. So the other update we do want to make you aware of for the ADEX examination, there has been a change or an adjustment to the point deduction for the specific error of request to remove caries or decalcification without clinical justification. So that was a penalty that was 16 points and has now been increased to 21 points. Now, this is a specific kind of error. This is not just requesting to remove caries and what was there just didn't meet the definition of caries. Again, the definition of caries for the ADEX exam is penetration using penetrable, caries that is penetrable with a sharp explorer using light pressure exhibiting tug back. So that's how we define caries for the examination. It's a tactile sensation, not color, discoloration, and so forth. So if a candidate requests to remove or to modify the preparation and the why is to remove caries, if there is something there, whether it's staining and some kind of demineralization that just doesn't meet our definition of caries, that would just be a denied modification request. That does not meet this penalty or this rejection of the modification. What we're talking about here is if it's without clinical justification, meaning there is no staining, no signs of any kind of demineralization. And really what this is meant to deter is candidates who are requesting to modify on a wall because they're just not sure if there's caries there. They want the examiners to really tell them whether or not there's caries present. That's the reasoning for ADEX to increase this penalty, is it really shows a lack of judgment. It's not just not being able to really tell if it's caries or not. It's this surface is smooth, hard, clean, and there was really no justifiable reason for them to ask to modify it. So that's the penalty we're talking about here.
Now, if I can just interrupt Dr. Wall on one of the things that we've noticed when we did the update to the educators portal, you all got some increased benefits and some extra verification processes that came along with that. One of those things that is now part of that verification process is some of you may be seeing that you are being asked to verify for the candidates who've paid for the Florida laws and rules. It is up to you whether you verify them or not. We want to assure you that what you are verifying them for does not mean that they are fully capable and knowledgeable on the Florida laws and rules. You are not putting your name on the line for that. It is only opening the door that lets them move through to go ahead and take it. So it isn't putting, again, you on the line saying that you are verifying that they are ready for this. It is just part of that single part of giving you the ability to verify per part. It is one of those parts that these students are paying and taking. So if you do see Florida laws and rules, if you aren't, first, I would suggest go ahead and verifying them. We're not holding you to any kind of standard, but if you choose not to, the student will wait till after graduation, upload a diploma, and then they'll be verified to do so post-graduation. So again, just wanted to clarify, you may see that it is just part of making all of these things verifiable by you, and this is one of those elements. So not part of the ADEX exam at all, but we would appreciate it if you don't mind, go ahead and verifying them. It just allows them to pass through.
We're going to move on to some images that we collected. We wanted to show you some examples of candidate performance from these most recent examinations and just give you an idea of what to expect after things have been graded. So this is an updated view of what things look like, the presentation that we send after a candidate. These are for specifically unsuccessful candidates that you're used to getting a little different look to it here. You'll have the information as far as the candidate ID number, the procedure, and then what was the criteria that they failed for. And so we give representative images of the criteria. And one thing you'll notice moving forward is we've removed the measuring instrument. We found that sometimes that would kind of get in the way, and this allows for a little more holistic review with the candidate of what the errors were, and then also kind of removes that because sometimes we get messages from candidates and they kind of would think that this is exactly how the examiners held the probe or what they were looking at. And those of you that are aware of our processes, this is done completely after grading. Grading is done by 3 independent evaluators that don't talk to each other about their grades. So it's validated on site. It's validated through the 3 examiners looking at it. Any candidate that's unsuccessful, there's an experienced grading captain that comes in and reviews and ensures that everything was measured appropriately. So we validate all of these results prior to, and sometimes candidates would think that this was sent as an evidence or proof of their failure, and they didn't necessarily like how the probe was held or how the stent was placed. And so it just kind of, just to help with that process of just reviewing with the candidate, and just to let them know that really, this is not a validation of the result. This is just meant as a helpful way for educators to work with students to remediate and prepare for a subsequent attempt. So that's the intent, and we're hoping that these images are very helpful to you and demonstrate what you need as far as working with the candidates and helping them prepare for their next attempt of the exam.
And Dr. Wall, if I can add, we are working to improve this process. Those of you who did PEP this fall had the opportunity to understand that we were sending these out in record time. We used to say 10 days, but we were getting them out within 2 or 3. Some of that has come to automated processing of that criteria that you see at the top. So all the criteria for the unsuccessful attempt will be at the top, and the image will follow. Now, the image may be the same on the next 3 slides if that criteria listed was on the same procedure. So you'll no longer have that cover page. Right now, we're working on this in real time to try to get it as what you're used to looking at. But do know that you may look at 3 images of the same candidate with the same picture with 3 separate criteria.
Yep. Absolutely. We're happy to offer these to you, and we want to continue to do that and do it in a way that we can get it to you as soon as possible. We know that once results are posted, candidates really like to see those images as soon as possible. So we like to try to get those to you quickly so that you have that for your ability to work with faculty and students in preparing for their next attempt. So these images are an example of some things that when we started seeing some of the common errors from the fall, and we wanted to make sure we had some valuable information, some images for you. We did want to share some successful candidate performance, so you could have that as well as not just the unsuccessful candidates. So this is something that we sent out and wanted to have available to you, but we wanted to present this here as well. So here's some examples of instrumentation and gutta-percha fill that would be considered clinically acceptable as far as the examination criteria. This, again, is the most common error that we're seeing. And you can see the extent to where they may not have felt that bottom out at the bottom of the sulcus of that model there. So that's where really it allows for a more overfill. And so this is an example of one of those. And here's another example where the candidate really, possibly some over instrumentation of that apical orifice there, and then the gutta-percha extending beyond the apex greater than 0.5 millimeter. Perforation, this is something most commonly we see on the mesial extent. We are, like I said before, with this new model, we are seeing less perforation, but it is something that we are still seeing, and that's this is just an example of that. And it primarily really is on that mesial side is where we're seeing it, which is where you'd see it primarily in patients as well. Again, another example of unsuccessful posterior endodontic access with some of the roof intact and so forth. You see some different errors there. Placement error, obviously, here. We just wanted to give you some examples of some of the things that we're seeing as far as candidate performance with these exams. Here's an example of wrong tooth. Just as a reminder, when they start preparing the wrong tooth, so this is an example of a prosthodontic error. They started the preparation of the crown preparation on the endodontic tooth. This would not be considered a failure of the endodontic exam. This is an error of the prosthodontic exam, and this is one where they would just need to, as soon as they recognize that they've prepared the wrong tooth, whether it's the endodontic exam or the prosthodontic exam, as instructed in the manual, they should identify this and get a floor examiner as soon as they recognize the error. In this case, the endodontic tooth would be replaced so that they can go ahead and proceed with the endodontic exam on a tooth that does not have the beginnings of a crown prep. So as soon as they recognize the error that they've started prepping the wrong tooth, they just get a floor examiner and they'll work with them from there. This is an example of the PFM crown preparation on the premolar, an example of some over tapering. Remember, for the exam, we don't evaluate convergence, we're evaluating the taper of the wall. And this is an example where that taper is over tapered, but also the proximal over reduction. And that's something that we did see as a more common error this year for the class of 2025 is axial over reduction of the premolar. And this is an example of that, where it's not only over tapered, but over reduced axially as well.
I would guess this could also be a path of draw, most likely.
It could be, right. The path of insertion is definitely, definitely towards the distal. And then, what would that look like? This could also be an example of the path of, the bridge factor as well between that and the molar. And here's an example of a molar that had various errors contributing to failure for this one, including the line angles that just had no evidence of rounding and some other concerns there.
So those images, just to reiterate, were from this class of 2025. We just thought we'd gather a couple and demonstrate them here. I know you all use the resources that we provided in the past of both prost and endo for unsuccessful attempts. We'll continue to provide that and send those out as we get more images available. But Dr. Wall, anything else you'd like to cover? I think this has been fantastic. We are right in our window of 30 minutes of getting them some short and sweet, but extremely valuable information.
Yeah, no, absolutely. Just, I guess the only other closing message would be just if there's anything that we can do to support you, if you have questions, we're happy to serve as a resource to you to help answer questions about content, criteria, and just appreciate the opportunity to work with you. And thank you for giving us the opportunity to come into your schools and be guests at your schools to administer this examination. We're honored by that privilege of being able to cooperate with you in that in order for us to administer this examination and appreciate that cooperation that we have with you. So thank you for that.
Yes, absolutely. Thanks everybody for watching this recording. Again, please share. Dr. Wall, the one question I know I'll get really quick is, can we share this with students?
Yeah, I don't see any reason why not. This is information that we hope is helpful for you in working with them and helpful to them as well. Yeah.
And the message is geared toward you as faculty. So please don't, I know the message will come, can we share this? So please know that, yes, we will not be sharing it directly with them. We share it directly with you. And from here, the ball would be in your court, if you will, the proverbial ball of sharing it if you feel necessary. So, right. Dr. Wall, thank you so much.
You're very welcome. Thank you. This has been, yes. I always enjoy it. And we just hope that this is helpful and valuable. And yeah, thank you.